Dr. Suzanne Turner. She's going to be speaking about how cell inflammation is the cause of serious disease and cancer. And oh my goodness, Dr. Turner, we got the background working. Woo! I love it. All right, Dr. Seeds, how do we know Dr. Turner?
Well, I have been very fortunate to have been had Dr. Turner working with me for many, many years. One of my original cellular medicine fellows, and I'm going to just say she visits us from the East Coast, from Atlanta, the Atlanta area, from Georgia, and she is the quintessential epitome of a doctor that goes at it like no other person. I mean, I can't say enough about her talent. I can't say enough about her wit and her desire to continue to learn. She's been with me over 3 years, and she continues to challenge me every time I'm with her. And it's awesome because she continues to drive me forward in pushing the limits of where we go with understanding cellular medicine. And we've shared patients. She's just an incredible doctor and a caring person. And I think you see this theme coming up on over and over again. It's these caring, unique physicians that walk the talk and represent what we're all about. And Dr. Turner is every bit of that. And I've got high aspirations for her, and she knows that. And she's just a wonderful person. And I'm just so happy to have her here to represent the FSSRP and to share some of her knowledge with our people today. So Suzanne, thank you so much for being part of this and contributing to the knowledge base of our patients today, our people out there today that are here to learn.
Thanks, Bill. I was so excited to get this topic from you. You knew exactly what I needed to talk about today to challenge me and push me past what I know. So that's what you always do, and I really appreciate that. This is so exciting to be part of something where we're actually giving back, because so many times we do these things for industry or for other reasons that aren't as altruistic as this is. And this is really in my heart, to be taking care of patients, which is what I think we're trying to accomplish today, is letting people know that this kind of medicine is out there, and it's because of you and what your team has done. Thank you so much, Karen. This blue screen would not be without you, or my sweet husband who created up tonight. He was up with me last night helping me figure out the screen. Anyway, thank you all for being here today. And thank you especially, Dr. Seeds, for all you've ever done for teaching me.
And thanks, Chip, for helping.
So let's get started today. This is how we're talking today about how the cell inflammation causes serious disease and cancer. And what we're talking about is sort of in a little bit more detail. We've been honing in as we've gone throughout the day, kind of honing in a little bit more on what's happening. This is an area that's near and dear to my heart, because this is a big part of my patient practice, is some sort of inflammatory cause begins the problem, and then the cascade just continues to decline. And so explaining how this happens in cells, so many of my patients want a diagnosis, like what exactly is wrong with me, Dr. Turner? Do you have a definition of what's wrong? And I say, what I really want to do is make your cells work well. And it doesn't matter what the diagnosis is, because if your cells are working well, we can handle whatever comes our way. So that's where we are with this. This is my disclaimer to remind everyone, please use your own professional person, whoever takes care of you, that you are, their opinions and their knowledge of you is much more paramount to what I'm saying today. And they know you better than I do, of course. So take this for what it is in my experience. So it's interesting, over the last several years, the cancer research has moved from being a cell-centric to an environment centric. So the cells, rather than looking at the actual cancer cell itself, we're starting to look at cells in their environment and how they function and respond to the things that are around them. And so these cancer cells not only are the problem themselves, but they also function in a system. And there are especially inflammatory immune cells that create this tumor microenvironment around the cancer itself. And so they have both anti-tumorigenic function, which is there in immunosurveillance and in watching what's happening in trying to allow the immune system to be able to kill both viruses and bacteria and cancers, as Dr. Bautista so brilliantly gave us examples. And then the immune system also involved in this pro-tumorigenic inflammation that blocks this tumor promoting signals. And so there's this sort of both sides of the immune system functioning. And as Dr. Cease has taught me before, to think about this as binary, that the immune system in the face of cancer functions in both directions, both triggering and decreasing cancer promotion. And in almost 20% of cancer cases, there is some sort of infection or inflammation or autoimmunity that began this process, that we know of that began this process. So I imagine that number is actually higher without a clearer, without a clear diagnosis of that. But I imagine there was some sort of precedent that occurred. Low-grade things like obesity, hyperglycemia, and excess lipid accumulation we know are involved in development of cancers like liver, pancreatic, colon, and breast cancers. This is why, if your doctor is saying, you've got to work on that weight, you've got to start exercising, we've got to take care of yourself a little better, it's because all of these things we know are associated with the development of not only cancer, but aging and disease in general. And then there are several examples of infections in being involved in causing specifically colorectal cancer in this study. And that would be things like infectious hepatitis, H. pylori, which you're aware of, causes some of the people who experience peptic ulcer diseases or gastric inflammation in general. And then schistosoma can also increase the inflammatory process. And this begins the cascade that goes on to things like cancer. Other pathogens can be associated with development of cancer, and we know that any disruption of your natural microbiome can cause this. So I ask patients all the time, what was your childhood like? Tell me about any significant childhood illnesses you may have experienced. Did you have recurrent ear infections? Did you have to go on antibiotics for various reasons as a child? Was there a time when you had to take antibiotics for we also know that even the antibiotics that are given to women during delivery, during the peripartum period, they also can be associated with development of inflammation in the infant. And then these intestinal pathogens specifically related to colon cancer, we know are related to can be a source of inflammation in the metastasis itself. So as the pathogen is present in the body, and the body develops a cancer as a secondary event, the spread of that cancer can be worsened by the fact that the pathogens are present as they contribute to stimulating the immune system and causing more inflammation. Pancreatic cancer, we know, is driven by chemical messengers that are caused by bacteria, and then non-alcoholic fatty liver disease. You probably heard of fatty liver disease. These are also promoted by intestinal bacteria, and those bacteria themselves produce inflammatory chemicals, which signal our cells to begin to deteriorate in their ability to function optimally. We also know that lung bacteria are also involved in the development of tumors. There are two sides of the immune system that function together as well as independently. The first responders is this innate immune response. We have heard about all of this with COVID. I think many of my patients come to me much more educated now that they're being told about it on the media. But anyway, this innate immune system is your first responder, and this occurs in the first day of being involved in some sort of inflammation, and typically pathogens. These natural killer cells are one of the cells, you heard Dr. Erica speak about this earlier, one of the cells that are involved in fighting both viruses and bacteria. and cancers. And these cells are upregulated in response to some sort of pathogen or trauma to the cell. And their activation causes the body to go on alert, and now they begin to send out inflammatory chemicals. This sends messages to the bone marrow and the thymus gland to stimulate B lymphocytes and T lymphocytes to go into action and begin the process with the body of restoring normal function of the cell by killing or removing cells that are affected by the infection or the cancer. The innate immune system, the monocytes are one of the cells that are primarily involved there. They persistently produce pro-inflammatory chemicals. And these pathogens, genetic mutations, other diseases can cause this in the chemical messenger system, can cause this auto amplification and chronicity of the inflammation. So you start with some sort of minor infection or trauma, you increase your production of these inflammatory chemicals, and due to some sort of cellular misfunction, either with a genetic problem or with persistent pathogens, these can continue this inflammatory process and make it chronic. And that chronic inflammation is where we begin to see cells start to function poorly, and now we have problems develop, such as cancer. These inflammatory chemicals begin to skew the development of T cells in the direction of autoimmunity and away from them being helpful regulatory cells. So these microglia are what we call these macrophages in the brain. These cells, as you can see on the left and right, can be converted into one or two different forms. They're either this, I call it henny penny, which is, oh my gosh, the sky is falling, everything's terrible. They secrete pro-inflammatory chemicals, or they can be converted into what I like to call the janitor, which is the cleanup crew, the calm, everything's calm, sending out anti-inflammatory chemicals, telling cells everything's okay, not recruiting other cells to the area. And so you get both of these different kinds of cells, and cells can express each of these different, what we call phenotypes, which is sort of a personality of the cell. These cells can demonstrate either one of these phenotypes depending on the environment where we find them. We know that this activation of these cells in this henny penny sort of form has been associated with all of these different diseases, even migraine, mood disorders. This is present after a traumatic brain injury, in chronic kidney disease, even in morbid obesity. So my patients who have BMI greater than 30, we'll begin to see them having problems with the way their cells function. And now they're attracting these inflammatory cells to the area and giving themselves a risk of inflammation and ultimately chronic inflammation and cancer development. Diabetes is part of this process. These are also some other disease states that are associated with dysregulation of the immune system. So that chronic inflammatory process, we know that gout, even osteoarthritis, which has in the past been has sort of been poo-pooed as an inflammatory path. You know, when people will say, well, it's not really a rheumatoid type or a lupus type disease, but it really is. There's an inflammatory dysregulation that goes on causing osteoarthritis. Things you're familiar with, like scleroderma and lupus, things we aren't super familiar with, like chronic kidney disease, where you wouldn't necessarily think of that being an inflammatory process, but it is. And this same process occurs, some sort of trauma, some sort of infection, some sort of inciting event occurs to the cell, and now you begin to get this inflammation. We know that it occurs in Addison's disease, in heart disease, in chronic liver disease. So you can see it's part of the disease process, this inflammatory autoimmunity that is part of the process of this disease, many diseases occurring. So this is why I say it's not so important that we know exactly what your diagnosis is, as it is to know that your cells are not functioning optimally and that we need to move forward in optimizing how your cells function. obesity, as I mentioned before, these cells can create this inflammation because they're drawn to the area where these fat cells are not functioning optimally. They're recruited, and then they're also retained in the area. So the chemical messengers that fat cells send out retain these cells in the area, and then these cells continue, these macrophages continue to create these inflammatory chemical signals. They also produce a lot of what we call reactive oxygen species. So you know about ozone is O3, and O2 is what we breathe every day, that's regular oxygen. And then these are the reactive oxygen species that are created by our cells as they begin to struggle and not function optimally. And so reactive oxygen species can go around and damage your proteins in your cells. They can damage your DNA. They are a lot of this cellular, when your cells are under stress, they're going to increase both the production of inflammatory chemicals, but also the production of these cell damaging reactive oxygen species. Everything in balance, we like to have a little bit of reactive oxygen species to get our cells to continue to function. But when it goes too much, we're talking about the Goldilocks phenomenon. If it's too much, we're running into trouble. So keep in mind those reactive oxygen species. These chemical signals in fat cells will impair the action of insulin so that the cells decrease their energy supply. And now this blocked insulin signaling causes more cellular stress. So now these cells that were under stress to begin with begin to have more and more stress, more reactive oxygen species, more inflammatory chemicals. It's this self-perpetuating problem. And here's just a picture. I like to show pictures to say what I said before, but this is your white adipose tissue. That's what WAT is. And in the face of calorie excess, a healthy expansion would show this improved insulin sensitivity and decreased inflammation. And then when you have unhealthy expansion, either due to poor insulin signaling or the presence of a trauma or inflammation from other causes, you get decrease in production of new fat cells. They get hypertrophy of existing or enlargement of existing fat cells. You decrease in insulin sensitivity, you create inflammation, and then macrophages come to the area and become that henny penny personality and begin to cause all kinds of problems, as you see to the right in pink, where it talks about fat and insulin resistance, type 2 diabetes, heart disease, etc. And then in healthy, this was something super fascinating to me. These in your colon, as your cells begin to lose their efficiency, they no longer take the oxygen from the bloodstream and keep the environment in the lumen hypoxic. The decrease in hypoxia inside the colon then causes growth or overgrowth of bugs in your intestine that prefer to be in an oxygen environment. And these are not your healthiest bugs to be present. In fact, they will then turn around and change the ability of the cell to function optimally. And so we know that increasing oxygenation of the cells can improve the ability of those cells to function and decrease the risk of colon cancer. The opposite is true, that if there is not enough oxygen in the lumen, I'm sorry, if there's too much oxygen in the lumen because the cells are struggling to survive because of infection, because of antibiotics, because of alcohol dependence, because of a high fat diet, all of those will cause an overgrowth of these pathogenic or more pathogenic bacteria, which will allow for the development of things like colorectal cancer. And so in this study from 2019, you can see this is inflammation ultimately resulting in development of colon cancer because of cellular cells not functioning optimally. And so as these tumors, the same thing happens in tumors, as the tumors begin to secrete those chemical attractants, they recruit these macrophages to the area, they physically damage normal tissue. I'm sorry, the tumor can physically damage normal tissue, and then that damaged tissue can activate those macrophages as well. So not only is the tissue itself calling these inflammatory cells to the area, but the the damage that occurs from the tumor can also draw those to the area. And so again, this is just this auto amplification process. That this uncontrolled growth requires adaptations in energy metabolism, and a cell that is already struggling to function is unable to adapt efficiently to the needs of energy for that cell. So now, instead of producing good amounts of ATP like it should, the cells begin to go through anaerobic glycolysis and produce high amounts of lactic acid. This makes the environment acidic. And so if you've heard us talk before, or if you've heard the talk on a lot of media about the acidification of the environment around COVID-19, this also contributes to the optimal function of not only the cancer, but coronavirus. And so the cells themselves contribute to this optimal function of cancer and infection. This acidification increases the aggressiveness of the cancer, including evasion of the immune system, and increased angiogenesis. This microenvironment is also resistant to many therapies. Butyrate, Dr. Bautista mentioned ketones earlier, and butyrate naturally is produced by your colon cells, and it improves the oxygen consumption of those colon cells. 3 days of antibiotics can completely destroy your bacterial groups and decrease the ability of the cells to produce their own butyrate for energy production. So this is what contributes to that failure of the cell. Metabolism of butyrate depletes the local oxygen, which improves the kinds of bugs that are there present in the intestines. When this process fails, we get this development of cancer, because the cancer cells prefer to use glucose as their primary fuel source. But we know that butyrate can be used to activate AMPK in these colon cells and inhibit that glucose preference for cancer cells. So now we're using something very simple, which is derived from healthy cells, healthy bacteria, to prevent cancer. And so this is one of the options. It certainly is involved in improving patients' colitis, and there's several articles available on using short-chain fatty acids in treatment of colitis and prevention of cancer. These, again, tumor-associated macrophages. So this is where that interesting dichotomy occurs with these patients, these macrophages. So they can promote tumor cell growth because they sort of stand as sentries on the outside of the tumor as it progresses, and prevents the regular immune system from coming in. So what we typically think of as these calm janitor macrophages now become sentries, where they say, no, there's nothing here for you to be worried about. So the rest of the immune system goes, okay, everything's fine, and it allows that tumor to continue to grow. These cells produce high levels of reactive oxygen and nitrogen species, and that continues to contribute to that DNA damage, as we mentioned before. And that DNA damage is involved, as we talked about P53, I'll get there in just a second with P53, but this promotes the blood supply and lymphatic drainage, allowing for metastasis of cancer. Again, these macrophages just produce these reactive oxygen species, causing the cell to be under continued stress. These stressed cells can't handle it. They not only excess glucose or fat are stressors, but also the inability of the cell to produce its own energy. An intelligent cell has the ability to go through a cleanup, which is autophagy or cleanup phase, so it can take care of itself. It can go through apoptosis, as the previous speakers have mentioned, this programmed cell death, just taking care of diseased or damaged cells, or it begins to go through this process called senescent. The stressed cell makes more cholesterol, it burns glucose more inefficiently, it decreases this more efficient fat burning, it creates more reactive oxygen species, as we've mentioned. It burns through all of its energy, and the NADPH is increased in attempt to handle this reactive oxygen species. This stressed cell slows down, the trash builds up. Imagine doing your job with your room full of trash. The trash builds up and the nucleus turns on p53 to stop reproduction and handle the stress. It calls in the immune system to try to go through autophagy and apoptosis, but these immune cells are also stressed. And so they become inefficient. They compete for increasingly limited energy and they begin to spew inflammatory chemicals, as we mentioned. This DNA damage occurs, the organized cell death is no longer an option, and the senescence begins to take over. The downside is senescent cells will affect your tissue ability to heal through stem cells. So what is cellular senescence? It's a stability response. Its intention is to prevent propagation of damaged or diseased cells. It's triggered by all the things we mentioned before. Oxidative stress, chemotherapy, or radiation can trigger this. Impaired autophagy, mitochondrial dysfunction, or energy source depletion can cause this. It triggers the DNA damage response and begins this a personality, as I mentioned before, the personality, but it's unique to senescent cells. And unlike programmed cell death, which is sort of packing up the house to put it on a truck to move it away, this senescent cells remain metabolically active, and they specifically affect your healing cells called stem cells that are close by. It is beneficial as an anti-tumor response. If we can get your tumor cells to go into a senescent state, this is a way we can get your immune system to find them and break them down. However, it does contribute to the loss of function in aging and age-related disease. So again, a double-edged sword. P53, many functions in the body regulating cellular balance. It has the opposite action of nuclear factor kappa beta, which we know is an inflammatory signal to the cell, telling the cell that things are stressed. P53 has that opposite action. And then copper-induced stress modification of P53 can be associated with progress and invasion of tumors in colorectal cancer. Dr. Seeds mentioned about elephants and whales before, about they have so much more P53 and we depend on our one P53 to function. The bright side, again, this plus and minus, the bright side of senescence is the prevention of fibrosis, prevention of disease. The downside is impairment of and disease promotion and ultimately development of cancer. Tumors can hide out, they can keep themselves from being seen by your immune system, and these cells can have hypermethylation increase significantly, so they're not able to produce things that would stimulate your immune system to come and get them. They decrease the production of those, hey, there's a cancer here, and so the cells have trouble with that. And so we can use things like ketone esters because unlike healthy tissue, cancer cells are unable to effectively use ketone bodies for energy. And so especially in metastatic cells, we know that the Warburg effect, which is that these cancer cells prefer to use glucose as a substrate, particularly in anaerobic glycolysis. So we can use ketone esters to help healthy cells to function in the presence of a cancer, or especially in cancer treatment. We know that fasting and calorie restriction, the benefit of that is the production of ketones, and that these have been successful in slowing cancer progression. It would be part of your therapy. These can inhibit the proliferation and viability in cultured tumor cells. And this study showed that in mice, supplementation with ketone esters with systemic prolonged survival in rats with systemic metastatic cancer by 69%. And that did not depend on whether they were calorie restricted or if they had what their glucose levels were. So at least in this rat study, we had pretty significant results, 69% decrease, nice p-value there. And again, just a picture so you can see where it says BHB, that's the term for ketone esters, how it affects in so many ways, improving glycolysis, improving the, decreasing the nuclear factor, going to the nucleus to tell it to turn on the inflammatory process, improving NADPH's ability to decrease reactive oxygen species, decreasing that inflammasome, the sort of bomb that sits in the cell, can be very helpful at all kinds of points in these cells. the stressed out cells. And then looking at thymosin alpha, I will just quickly, it prevents the reduction. So cancer cells will decrease your production of cancer fighting cells. And thymosin alpha 1 specifically works to prevent the reduction of these natural killer cells being active, and also preserves barrier integrity. So not allowing the cancer to spread beyond its bounds. It is involved in Treg cell development, which would help with that inflammatory process. And then we can use, there's another peptide that's available called RGD, and also the FC domain of IGF-4 that can be bound to TA1 and improve their effects, higher anti-tumor effects compared to its alone. Our cells produce interferon gamma, one of the chemicals that helps to kill off cancer cells, and TA1 with these various modifications can also be helpful. It can increase that MHC class. That was what Dr. Bautista was talking about a minute ago. These sort of flags on the outside of cells that say, hey, there's a cancer here. And it improves that, making tumor cells visible to the immune system so it can clear it naturally. There's studies in both metastatic melanoma, liver cancer, small cell lung cancer, and versus these current breakthroughs in these checkpoints that everyone's spoken about today, thymosin alpha 1 has no toxicity, and as opposed to the existing therapies that can have excessively activated immune response, TA1 just knows how to stimulate the cell appropriately and does different things in different cells depending on what the cell needs. You can see that most of the newer research in peptide therapy is in oncology, with metabolic coming in quickly behind. And that's what I've got for today. Thank you so much for your time and attention.
Suzanne, that was a wonderful job of putting together a very complex topic and just bringing to light the basics of inflammation leads to potential DNA modifications that can lead to mutations that can lead to cancer. And if we do a better job, like you so thoroughly discussed, in helping and preventing inflammation, or knowing how to treat inflammation in multiple ways in the colon, in particular, and other areas in the brain and so forth, then we have a model of how we can potentially work with cancers or work in fighting against cancers and through metabolism and so forth. So you did just a wonderful job of bringing out this story that is so important in hematological cancers, because they're all about the environment. They're all about the tissue environment of the acidity created by the lactic acid and how that influences any of the immune cells because they can't function normally. And we'll bring this all back here at the end. And I think thank you so much. You did a wonderful job in presenting this and making everybody understand how important understanding inflammation is. So thank you.
Thank you, Bill. It's a pleasure to serve with you.
Thank you, Dr. Turner. My goodness. Not only is she an amazing MD and researcher, but she is also a chicken farmer. We were talking about that. And what I love about our SSRP fellows is they all walk the walk, right? They don't just say, hey, you need to exercise, you need to be healthy, you need to eat right. These doctors do it. And when we get together and we do some of our casual events, I mean, they're ripped. They do deadlifts. It's truly remarkable to see how all of these docs here walk the walk, and it's evident in Dr. Turner. So thank you so much, Doc.
Thank you, Bill.